So hi everyone, my name is Megan and my practicum was with the Wells Grey Country Senior Society and working together with my practicum supervisor, we focused on creating opportunities that supported the social vibrancy of older adults within Clearwater. So a little bit about Clearwater. I've incorporated this quote just because I think that it's really fun and it kind of captures the essence of Clearwater. And the quote is, "There's no power for change greater than a community discovering what it really cares about." And for Clearwater, it's the people. We are people. We're a small, interconnected community that's heavily reliant on our people and our community members and stakeholders to make Clearwater a place where people really do love where they live. So with COVID hitting, obviously we've all been impacted in different ways, but mostly it's impacted our ways of connecting with people and connecting with our people. In grade 12, I started this program thing, which basically just taught older adults how to use their technology devices. And some of the questions that came out of that were really, really, really basic. Like, how do I even attach a photo to an email? So going into this practicum, I went in with the assumption that as a tech-reliant society, many older adults may lack the knowledge or resources that are needed in order to connect this way, which may contribute to isolation. And I really wanted to address this issue. So my objectives and intentions throughout my practicum, firstly, was to reduce social isolation in older adults. Secondly, was to sustain these social connections by creating avenues for which people can stay safely social in person. In Clearwater, we have a big access problem to internet and cell service. So having that in-person interaction can do a lot for people. Thirdly, I wanted to educate people on the importance of social connections. And lastly, emphasize that health needs is so much more than just physical. As the World Health Organization puts it, it's not just the absence of disease or infirmity, but rather a network of health pillars that help sustain wellness. So this is basically my practicum. It started out as this idea called the Sip and Social, which people would go in and have tea. They could bring some knitting or cards or even just stories to tell, and they would have tea face to face with another person. They would sign up for a tea time, and I would randomly assign people to different tea times just to eliminate any biases or it's a small town, things get around, and sometimes ancient history that you think was put to rest 20 years ago has not been put to rest. So I just really wanted to make it open and inclusive to everybody. I've also created these Sip and Social booklets, and they just had some opportunities that these people could use to stay social together, whether that's discovering new walks or just some activity ideas that they can use to stay connected with their person who they met. I also really appreciated this opportunity because it gave me a chance to talk to some of the people within our community and to constantly assess what people would like to see for older adults, especially in regards to the social context, which help design these program blueprints, I'm calling them. I don't really know a better way to put them, but they're essentially just a booklet of ideas that could be implemented to support the social vibrancy of Clearwater even after my practicum is done. And then the other thing that I've done is created an infographic to help with stakeholder involvement. And this is just essentially outlining the harms of social isolation as it relates to the physical, mental, and emotional domains of health, and emphasizes that COVID-19 does not mean that we have to stop being social, because that's really a detriment to our health. So looking at the public health social policy skills, firstly is the knowledge translation and communication strategies. In all the publications that I made sure that my fonts were super big, even the infographic. My mom, she has readers now and her eyes are starting to go, and she had some things to say about my infographic and just making it a little bit more legible. I also focused on the no-do gap. So I put in a lot of research and had to present it in a way that people are relating to it and can actually understand it. And it also brings awareness to the importance of nurturing social health to community members and stakeholders to increase the demand for opportunities if the community is ready for it, of course. Secondly was the facilitation of health literacy. As we all know, health literacy is the first step in self-care, and it presents it creates a framework so that people actually know how to take care of themselves. And by creating a simple yet social space, as well as future programming for social opportunities, it's aimed to disseminate some of this anxiety surrounding COVID-19 and our social well-being. But it's also raised awareness to the community members about their level of health literacy as it relates to social health through effective knowledge translation and to improve health outcomes during the pandemic. And last on the list is program planning. And through this continuous needs assessment, I was able to listen to the community members to see what they would like to see implemented and hopefully help with the community readiness of social opportunities being slowly reintroduced. So the most valuable takeaway from my practicum, I'm the kind of person who likes my spreadsheets and my color-coded pens and my whiteboards and all that jazz. But I've had to learn how to be flexible in a world that's always changing. My key insights were that people wanted to be social, but needed a space and an avenue to do so. And working as a team made things so much easier. Being able to bounce my ideas off of people was really helpful. My surprises and proudest moments was primarily from the people who attended the Sip and Social, saying that this was like their first outing in like 4 months, and just being able to reacquaint old neighbors or people who live down the street from one another and they haven't talked in 15 years. So that was really rewarding for me. So for the future projections of the social vitality of older adults in Clearwater, I've identified some gaps that I would like to see filled as my position as the Community Recreation Healthy Living Coordinator for the District of Clearwater. One is that we're in need of more functional spaces that can provide these social opportunities. Two would be that these opportunities have to be intergenerational, because through my research, it's actually not older adults suffering from social isolation during COVID-19, but young adults. And thirdly is to utilize our community assets and infrastructure to be able to make these spaces functional and provide these opportunities. Lastly, are my thank yous. I want to give a huge thank you to Natalie and Betty. You guys have been absolutely phenomenal. Thank you to my practicum supervisor, Lynn Frizzle, the community of Clearwater, and my BA professors over the years, and of course, my practicum pals who have made these last few years just incredible. So thank you all.